It's important to have a balanced and varied diet to maintain overall health, including kidney health. However, some fruits may pose risks for people with certain kidney conditions. Here are some fruits that can be problematic for individuals with kidney disease or predisposition to kidney problems. Bananas. Although they are a rich source of potassium and nutrients, bananas can be problematic for people with advanced kidney disease. The high potassium content can be difficult to filter by compromised kidneys. Oranges and orange juice. These citrus fruits are known to be rich in potassium and citric acid, which can be challenging for the kidneys in case of kidney disease. Melon. Melons such as watermelon and cantaloupe are delicious and hydrating, but they are also high in potassium, which can be a problem for people with kidney disease. Kiwi. This fruit is rich in potassium and can increase levels of this mineral in the blood, especially in people with compromised kidney function. Mangoes. Mangoes are delicious fruits, but they also have a significant potassium content, which can be a problem for those with kidney issues. Dried fruits such as raisins, prunes, and figs can be concentrated in potassium and sugars, which can be challenging for the kidneys. For individuals with kidney disease or predisposition to kidney problems, it is essential to limit the intake of fruits high in potassium and consult a doctor or nutritionist for specific dietary guidance. In many cases, it is possible to enjoy a variety of fruits in moderation, provided there is careful monitoring of potassium levels and other nutrients in the blood. Join us for a journey towards a healthier life. Subscribe now to our health channel and start transforming your health today. Don't miss out on this opportunity to learn valuable tips, gain useful insights, and discover the secrets to a life full of wellness. Subscribe now and take the first step towards a healthier, happier life.